Video shows stabilization of subluxated in-bag IOL after progressive damage to the zonules in pseudo-exfoliation case. The towel flap is made and marking is done with 8 marker. 2.5 mm mark is done from the limbus at 0, 180, 90 and 270 degree. 2 marks are made 2 mm apart from the center mark and partial sclerotomy is done. 10-0 proline suture on straight needle is passed behind the iris and it is retrieved from the opposite quadrant, and similarly it is passed from this side and it is retrieved on the same side. Suture is tied and then after cutting the suture, knot is buried inside the sclera. Similar procedure is repeated in vertical quadrant. 10-0 proline suture is passed behind the iris and behind the lens bag complex. It is retrieved inferiorly and then again it is brought back with a gap of 4 mm in superior side and it is tied, knot is tied. After tying the knot again, the knot is buried inside the sclera. During this procedure, a small seepage of blood is there in the anterior chamber. Two side ports are made and vitrectomy is done. With vitrectomy cutter, a PI is also made in superior quadrant. Then air is injected and conjunctiva is glued with the help of fibrin glue. At the end of procedure, 10-0 proline mesh is formed behind the lens, giving a posterior capsular support. Second video shows subluxation of in-bag IOL with CTR in the vitreous cavity. In the same manner, we have made conjunctival flap. First in a horizontal quadrant. After cauterizing the vessels, marking is done 2.5 mm from the limbus, 4 mm gap at 4 mm gap. Proline sutures is passed behind the iris and behind the lens bag complex, retrieving it in anterior chamber, and with the help of bent needle which also supports the lens bag complex, the proline suture is withdrawn in an opposite quadrant. The same proline suture is passed at 4 mm gap from the other point behind the iris and behind the lens bag complex, and it is retrieved in other side with the help of 26 gauge bent needle. During this procedure, tilting of this lens is seen. After tying the knot, a side port is made and the lens is brought over the suture. Now we can see it's in sulcus, well placed over the suture, well supported by the suture. The similar 4 mm marks are made and proline suture is passed behind the lens in a vertical section. Sutures are tied and the knot is again buried inside the sclera. Sinski hook is used to place the lens in a proper position. After making 2 side ports, vitrectomy is done to remove vitreous in anterior chamber, and a peripheral iridectomy is done with same vitrectomy cutter. This provides alternate passes to the aqueous to prevent pupillary block. Air is injected, conjunctiva is glued with fibrin glue. At the end of procedure, we have a stable lens in the sulcus.